Hi, everyone. Good afternoon. Thank you so much for making it on a Friday afternoon. We really appreciate your attention and interest in this really important topic. My name is Kristen Escamilla. I am an assistant professor and psychiatry clerkship director over at Dell Medical School in Austin, Texas. We appreciate your attendance, and attention during this important session. In creating it, we really wanted to focus on preparing people to take action in not only being against racism, but in actively being anti-racist. While many of us are well-intentioned and agree with social justice endeavors, we frequently rely on marginalized and oppressed groups to do that work, when in reality, it is everyone's responsibility to make change. As educators, we can begin to create this curriculum, and we should. But we also have to make sure that we do our best not to cause harm along the way. We may mess up, but when and if we do, we need to be prepared on how to respond to and correct any injury we may inadvertently cause. Additionally, if it occurs, how do we respond to cynicism or pushback when teaching or discussing this material? We hope that we can begin to answer some of these questions in order to be prepared to take action in our own institutions and lives. We are interested in your thoughts and ideas as well, so please feel comfortable participating as much as you can so we are able to all learn from each other. Our presenters will now introduce themselves to you and get started. I'm going to tag Pierre.
Hi, my name is Pierre Banks, and I am an assistant professor in psychiatry and behavioral science at the University of Texas Medical Branch, and I'm also the senior director for admissions and recruitment at UTMB as well. And I will tag Sarah.
Great. I'm Sarah Baker. I'm an assistant professor of psychiatry at UT Southwestern Medical Center, and I'm going to tag Rachel.
Hi, I'm Rachel Russo. I'm an assistant professor at UT Southwestern as well, and also the associate clerkship director. And I will tag Kathy Trio-Rochelle.
Hi, I'm Kathy Trio-Rochelle. I'm at UT Southwestern as well, and I'm the clerkship director there. And I think Aisha's here. I'm going to tag Aisha.
Hi, my name is Aisha Muhammad. I'm a second year medical student at Dell Medical School, and I will tag Dr. Patel.
Hi, I'm Premal Patel, Associate Professor in the Division of General Medicine in the Department of Medicine to the University of Texas Medical Branch, and I do a lot of course directorship in undergraduate medical education, and I'm very happy to be here, and I'm not sure there's anybody left to tag. Kristen, who else is there left to tag? I think we're all tagged out.
I think that's it. Yeah, so we're really excited. This has been a fun endeavor with a great team, and we've been learning through this process, and we hope that you will learn something as well. We'll get started. Let's go. So we have nothing to disclose whatsoever. We're just educators who love teaching. Here are our session objectives. So we're going to identify specific examples of curricular interventions based on anti-racism, recognize established and emerging frameworks to facilitate implementation, describe how to avoid common pitfalls during implementation, evaluate effective strategies to prevent, minimize, and mitigate unintentional re-traumatization of participants of color, and then develop practical approaches to responding to an array of participant reactions, including fragility, insensitivity, and anger. And I imagine if you're already doing this work, please, we want to hear from you, and we also want to get your advice and your expertise as well. So thank you for doing this work.
All right, so I'm going to start with some general principles of anti-racism. And so one of the first principles of anti-racism is rejecting race-based human differences and actively treating people as equally human, worthy, and intelligent. And so it's very important that as you do this work, that you kind of recognize these general principles of anti-racism. And so the first being that we reject the idea of human differences and treat people the same, even though that sounds kind of cliche, that is a principle. The next one is acknowledging that social constructs have actually created unique experiences for folks in along racial lines, and that's important. We say we treat people all the same, but we also need to recognize that because of systematic racism, folks have different lived experiences, and if we don't recognize that, then we're missing the mark. And that goes into the next point, which is celebrating and encouraging diverse perspectives. And so recognizing that people have different backgrounds means that they bring different perspectives into the classroom, into the clinic. And so it's something that you have to educate students about. And then also challenge and actively resist racist actions, policies, and systems. And that's on a deeper level. And so a lot of times that takes a while to get there, but it is part of one of the general principles. And so I kind of started with like the first principle, and they all kind of bleed into each other over time. Okay. So as you if you want to teach anti-racism, one of the most important things is to define race. And so at UTMB, we like to use Dr. Kamara Jones's definition of race. And so her definition is that race is a classification of humans into groupings based on physical traits, ancestry, social relations, and or relationships between them, okay? And that's something that we like to just say as a baseline, but then we have to also explain to our students that race is socially constructed. And you have to have conversations, and this sometimes can take students, it could catch them off guard because we're not taught that growing up. And so it's important to really take time to explain that, the demarcations that are used to sometimes group people into racial categories change over time. They're not always reliable. I think sometimes as scientists, we tend to think that we could be very objective and reliable in classifying race, but that's not always true. And there's a lot of research on that. Also recognizing that because of the systemic racism, race is sometimes inaccurately used as a proxy for socioeconomic status, culture, or genetic differences, and explaining that there's clear evidence that race is not a genetic concept, and getting them to understand that it's socially constructed. We as human beings have socially constructed this concept. And then lastly, we like to make sure that we talk about racism. And so a lot of times, and I think Dr. Kamara Jones does a great job of this, and it's cited there, but a lot of times folks think of racism as just personally motivated, okay? And she goes through 3 different levels of racism. There's the personally motivated racism, there's institutional racism, but then there's systematic racism. And we like to make sure that students understand all 3 of those levels. And Dr. Patel actually teaches our race and medicine lecture, and she goes through that very well for the students to make them understand that it's a system that's at play that assigns value based on social interpretations of race, and that we all participate in this system. And so instead of thinking of it as an action, a lot of times students come in with that framework. We have to think of it as a system that we live in and operate in. I think it was Dr. Brene Brown said it best, that racism is not the elephant in the room, it's the room that we live in. And that's something that we have to think about when we talk about doing this work with students. And so this is a very nice way to kind of work with faculty when you're talking about doing this work, but then also integrating, we think about integrating anti-racism into the classroom. The multidimensional approach of education that Banks provides is very good as a framework to figure out, am I covering my bases if I'm doing anti-racism work? And so the first is to make sure that you have content integration. So this is the extent to which faculty provide examples and also have content that is representative of different groups. And this is also called in some literature culturally responsive pedagogy. And so what this looks like is making sure that you have diverse representation in your course materials. So for example, at UTMB, we use a PBL model. So we try to make sure that all of our PBLs have different races represented, different cultural groups represented. And so it's very important to make sure that you have that within the content that you're teaching. The next is the knowledge construction. And so this is the facilitation of a student's understanding and exploration of their own bias, okay? And I teach our implicit bias lecture in our meta course that we have, which covers a lot of the cultural humility in our curriculum. And one of the things that I do in that implicit bias course is we do several activities that have them discuss what biases do they have, who are they? Because that's one part, and I'm gonna talk about that a little bit later, but where are they coming into this conversation with? And it's very important that they construct that knowledge for themselves. An activity that I have the students do is a brief writing activity where they talk about the first time that they had to unlearn something about a group of people, and they reflect on where did they learn that, why do they think they learned it that way, and kind of how they hope to change it, and how they did change their mindset. The next dimension is prejudice reduction. And so this is when you try to facilitate a learning environment that helps students have more positive attitudes towards different racial and ethnic groups. And so this might be an example of this might be emphasizing contributions for underrepresented physicians or healthcare professionals. And then also uplifting underserved voices within medicine. And so narrative medicine is, if you haven't heard of it, it's becoming very popular. Something that we do at UTMB to help with our anti-racism session is that we actually have a panel of students and residents and physicians that come in and talk about their experiences within medicine. We also have a vulnerable populations, and this is Dr. Patel's on the call, this is her work as well, but she also puts in her course a vulnerable populations panel where vulnerable populations can talk about their experiences in medicine. And so that's a way to help folks understand, what those experiences are like, and then start to relate to patients. And next is the equity, is equity pedagogy. And this is making sure that we adjust our instruction methods to ensure equity among all participants in the learning environment. And so this is making sure that assignments engage students in relevant issues that are related to anti-racism or inclusion and equity. And then lastly is the empowering the school culture. And this is more of a change dimension. And so the others that I talked about are things that you can actually make sure that you're implementing within your curriculum if you want to teach anti-racism. But this last one is more of a systemic, I would say, change component. And this is about restructuring the culture of the organization that you exist in. And so some examples of this might be making sure that you create different working groups to work on curriculum. So for example, at UTMB, we have an anti-racism task force that's working on curriculum. Dr. Patel actually has a group of students that work in the meta course to help facilitate some of the anti-racism work that we do there. And so there's a lot of different channels that you need to do this work in. And so doing that kind of creates the change over time. Some other relevant frameworks that we feel are important when you think about doing putting anti-racism work into your curriculum is you have to think about implicit bias. And so we kind of use implicit bias as one of the starting points to kind of talk about the conversation. And the reason why we start with implicit bias is because it happens outside of a person's control. And so they're not aware that they're doing it. And so that's a pretty non-threatening way to kind of start the conversation. And then it also, implicit bias affects their self-concept, which ultimately is kind of taught to them by their group membership. And so that could be a faith community, that could be a racial group, that could be a sexual orientation group. So you have to be very cognizant when you're doing anti-racism work that folks come in with their own thoughts about who they are and also who others are. And that goes into the identity development. It's also important that you think about that when you're doing anti-racism work. We just can't educate them on why they shouldn't be racist. We have to kind of start with, well, who are you and what do you believe based off of your background? And that's why identity development is crucial to this work. Another piece that's also very important is intersectionality. And this is a theoretical framework that was introduced by Kimberly Crenshaw. And this framework is that we have to understand how aspects of one's social identity might combine to create unique modes of discrimination and privilege. And this is critical to anti-racism work because as you do this work, and as you talk about identities, as you talk about where people come from, you're going to realize that folks have privileged identities and then they have identities that are marginalized, and they relate to each identity differently. And it's really important that you kind of talk to students about that, and that you recognize that not all people of a certain group believe a certain thing just because we see that on the outside. They may identify more closely with another identity that you know nothing about, and so or that you can't see. And then also critical race theory is important to this work because we don't exist in a vacuum in healthcare. And so we have to make sure that students understand that there are laws and power structures at play within the United States that have kind of, molded this racism that we live in, and that they have to understand the importance of power and how laws affect that. And so critical race theory does a great job of kind of bringing it home for students. Even though we're talking about the clinic and how to provide effective care, we also need to talk about this larger issue. And then lastly, I wanted to show this slide because I think it's really important. This is a group of family medicine docs kind of came up with this integrative model. And I think it really speaks to all the dimensions that I just covered and the theories that I covered. And so I thought it's something good for you to see, is that you really have to think about knowledge and then trying to think about then attitude. So how do people feel about certain groups, about themselves, about this work, and then you can get into skills. And so that's how we try to approach it at UTMB. And Dr. Patel is gonna tell us more about that.
Thank you so much, Dr. Banks. One of the things that we'd also like to do is learn from all of you what you're doing at your institutions, and also give you a little bit of an idea of what we're all doing at our institutions. So at UTMB, one of the things that we're doing is a host of what would probably be seen as quality improvement in our psychiatry clerkship. Some of our faculty are looking at particular word choices, and if there are bias in the word choices that are being used when consults are being reported and asked for, especially with regards to race. As Dr. Banks mentioned, the anti-racism task force of the curriculum committee has been looking at using the anti-bias checklist that was developed by Dr. Amy Caruso Brown, and really looking through all of the problem-based learning cases in the first 2 years of our School of Medicine education, and looking for bias, whether that's in race, in gender, in ability, in a whole host of different kind of categories, and providing that feedback back to the course directors with suggestions on exactly how to change the curricula. Not only have we noticed some of those areas for improvement, but students have also noticed those areas for improvement as well. The committee has also looked at doing climate surveys for students to actually look to see what our trends are over time and what the gaps are in regards to diversity, equity, inclusion in the curriculum itself. There have been modules developed around cultural humility that the psychiatry clerkship has adopted, where they're really kind of thinking through cases where they're not looking at individual diseases, but they're looking holistically at the entire individual in their context. And as Dr. Banks mentioned, in our meta course, our Mindfully Evolving, Thriving, and Advocating, we put the ideas of implicit bias, anti-racism, disparities, and inequities in healthcare and in medicine very front and center in the curriculum, and try to engage the students in these very nuanced, difficult conversations up front. Throughout the curriculum, in the 4th year of medical school, we have a health system science course, which revisits some of the same themes in a somewhat kind of higher level of consciousness, where students are now thinking not only their role as students, but really thinking in their role as future doctors and healthcare providers. And I will turn it over to our colleagues at Dell.
Great. Hi. So Dr. Trust was supposed to be here to be able to present this slide, but unfortunately she couldn't make the reschedule. But I just wanted to give her credit for all the hard work that she's done at our institution within the Department of Psychiatry program. And so I did focus a little bit more on psychiatry because that's our department, but just a little bit about what Dr. Trust and some of the others in our department have been working on is actually implementing within the curriculum a cultural and structural competency 101 course. This is set with PGY3s and PGY4s. So they go over a virtual privilege walk, understanding also the limitations of cultural competency and a discussion of why we're also including structural competency within their curriculum and their education. A lecture specifically regarding racism in psychiatry, and then also discussions surrounding addressing implicit bias and understanding structural formulations when it comes to psychiatric evaluations. The PGY4s then continue on to more of intense course as far as this goes. They actually have a community project embedded, so that they're currently in this stage. This is a brand new curriculum for this year. And so I'm really excited to see what they come up with and what they create. And then they also go over class case presentations with structural formulations. And this is just a small bit of what DelMed is doing, but in regards to the psychiatry clerkship, we've started implementing healthcare disparities discussions. And so I found that this is a really safe way for students to be able to bring up issues and concerns. As you all know, our students are really good about social justice and knowing a lot more than a lot of our faculty. And so it's also a good way to educate everybody in the process in a safe way. We also have a healthcare disparities honors project. So this is actually identifying something that they saw within the care of the clerkship and suggesting solutions as well. And so Aisha is going to talk a little bit about student work.
Yeah, thank you, Dr. Escamilla. So one of the organizations we have at Dell is something called MESH, which stands for Making Equity Standard in Health. It was started in 2016, and a lot of the main goals are mentorship, community service, advocacy, and education for people of color. One really great thing about MESH is that it's not just about students, but also faculty and staff come to our meetings, and that's a really amazing thing to see. Dr. Escamilla has been at some meetings, I've seen her there, and we've also had Dr. Joel Mullen, who's our Associate Dean of Health Equity, come and talk to us, and it's been really enlightening. It's really amazing to see the different levels within medical education who are there, who want to help promote equity within our curriculum and help get the community more involved with Dell. Some examples of things that we've done is we hold open houses for different students of color at the undergrad schools in Austin, so at UT and Houston-Tillotson, which is an HBCU, and St. Edward's, so we can get more students of color interested in medicine, and so they can kind of see a day in the life of a Dell Med student and ask any questions they may have, and we've had really great success with that. In terms of advocacy, we've done different things for maternal health for Black and Latinx women. With working with a specific organization called Mama Sana, which is a nonprofit organization in Austin that helps with giving culturally resonant prenatal and postnatal care to women of color. So there's some things we've done. In terms of White Coats for Black Lives, so this is a national organization that's its main goal is to dismantle racism in medicine and promote the health, well-being, and self-determination of Black and Indigenous people and other people of color. We started our chapter at Dell after the events of last summer. It was very much a student-run thing. We really pushed for it to start, and we've started, and it's been wonderful. We work with different organizations at Dell, including MESH, and then with some of our other minority organizations like SNMA, which is our Black Med Student Organization, and then Latino Medical Student Association as well. We've held a fundraiser for BLM that raised, I want to say, almost a few $100s, which was really great. And just recently, we wrote and sent a letter to the main UT leadership, just suggesting different demands for transformative change, including pushing forward a campus climate survey and renaming buildings that were named after Confederate generals. As Dr. Banks mentioned earlier, having or empowering a a multicultural like education and having that school culture is really important. So since we're part of the main UT campus, that's our campus too, and we care about diversity and equity over there. So we as med students have, that a little more leverage, and we have some say, so we want to use that. Thank you so much.
Great. And then also, you probably already saw a poster about it. I think that Dr. Nelson presented earlier. But we've also, as a medical school, come together and created a health equity core competency. And so along with like kind of patient care, medical knowledge, this is one of our core competencies. And so it's something that I'm very proud of that we've done and have accomplished.
Yes, so I'm going to be talking about the curricular integrations at UT Southwestern Medical School, and I wanted to give credit to Danny Morelli, Dr. Morelli, who created the slides and helped really spearheaded the development of the workshop, the anti-racism workshop that we're doing in our clerkship. So in the medical school, at the medical school level, there's a culture, advocacy, and health equity education committee that's working to overhaul and incorporate anti-racism and health inequities across the entire curriculum. There's also been responding to discrimination ethics sessions. In the psychology graduate program, there's been a social justice curriculum audit. In the psychiatry department itself, for the faculty and staff, there is a faculty anti-racism task force. There's also been a department-wide anti-racism needs assessment for trainees, staff, and faculty, as well as a workshop we did for faculty development during the Grand Rounds Times on addressing microaggressions and discrimination with trainees. Next slide. And within the psychiatry residency on the GME side, there's been a lot of different experiences. There was the workshop I was talking about that Danny spearheaded, and our residents and medical students too helped develop, that we ran for the first time yesterday in the clerkship, but it's for students and also residents and faculty and staff to attend. There's an intern orientation lecture on anti-racism and diversity. There's also a special considerations in psychotherapy case conference and special didactic lectures and seminars on African-American, Latino, and LGBTQ populations in psychiatry. We've expanded the literature in psychiatry series to include poems and short stories written by authors with culturally diverse perspectives and curated a cultural library. Next slide. There's also an official policy now supporting residents during community tragedies and events, formalizing program-wide reflection meetings and outlining avenues for individual support. The program's formal faculty and clinic evaluations have been revised so that they'll routinely assess discrimination and marginalization encountered on clinical rotations. There's also a longitudinal resident survey that was developed to evaluate trends in marginalization and gauge preparedness in professional spaces to help us figure out what we need to do for future educational initiatives. There's a resident-led discussion group called Conversations Among Peers for space to process, reflect, and support one another. And we've started a diversity and inclusion committee newsletter to share updates on the committee's project, enhance multicultural awareness, and informal education, and encourage resident participation in the committee initiatives. Good. And so I think now we're going to do a few minutes in breakout rooms where you all can sort of talk about what you've done at your school. Is that right? For about 5 minutes. So I'm going to open the breakout rooms and send you all there, but sort of if you can brainstorm implementation ideas and talk about what you've done at your institutions. Okay. Perfect. It looks like most people have joined. If you haven't joined and you need me to reassign you, please send us a message. And then if it's okay, I'm going to start assigning those of us facilitating to different breakout rooms and send you all to them. Okay.
I think Kristen went to 4.
Okay. Let's see. I don't know. I think I assigned one of you, Kathy. You may get assigned to 2. Since there's 2 of everyone, I may be assigning you to 2 different rooms. I don't know. Let's see. We'll try 1. Okay. Let's see. Try this. Okay. And then is anybody that's left in here, or do they need a room assigned?
I'm still not in
Yes.
a room.
Yes, it's your, let me just go ahead and assign you to a room. Okay. Let's see. Did you get an assignment? Yes, perfect. Let's see. Anyone else who didn't get a room assigned?
Hi, everybody. Welcome back. We're trying to figure out what happens to the PowerPoint when we leave. Okay, here we go. And so now, thank you so much for all that you talked about in your small groups, and also discussing like what are some ways that we could do this in our own institution. What are we already doing? And so we wanted to move to a large group just discussion. Feel free to use a chat if you feel comfortable, like using your microphone and talking with us. We'd love that too. But this is just a short example of something that we can work through together. So when discussing racism in a large group lecture setting, a female student states that she is equally marginalized because she grew up poor and female, even though she is white. So thinking about this example, what feelings might have led her to comment, and what feelings might this comment evoke in other participants, including the facilitator. And so I just wanted to see, feel free to use a chat box, feel free to unmute yourselves and talk, but what are your thoughts?
So at UTMB, we have the Academy of Master Teachers has a anti-racism book club. And so one of our first books was White Fragility. And this is exactly what she explained was happening all the time because of white fragility and just not being able to discuss systemic racism. And I think we had and Dr. Patel can speak to this. I think when we did our anti-racism small groups, we had a hard time with teaching people and really tried to work on teaching our facilitators to turn that back around, to kind of have that conversation of what might be provoking somebody to bring this up and how that gets away from the conversation that we're trying to have.
Yeah, when we had this discussion with the students, this was a very common sentiment. And it took me back to what Dr. Banks mentions a lot in his trainings, which is the idea of the oppression Olympics, and that this is not kind of the venue or the setting for it, and helping people kind of realize, like, cue into what it is that they're feeling or thinking, and helping them sit with that for a little bit, because, feelings are what they are. They're not good, they're not bad, but they are indicators. They're indicators that there's something here that's touching a nerve. There's something here that's bothering you. And then trying to unearth like what that feeling is. Is it that they feel like they are not being heard Is it that they feel like they are being their experience is being discounted in some way? So being able to validate that everybody's lived experience is completely valid and no one else is going to be able to truly understand it. And what we're trying to do is to kind of open up the ability for us to perspective take and to understand what it's like to live in someone else's like shoes or skin, you know? And so it doesn't mean that your own personal experience isn't valid and that you haven't also been marginalized. So I think it's trying to validate that everyone has a right to feel what they feel, but that also trying to see how it's possible to kind of use that and then being able to empathize with people that might be very different from them.
This is Robin Mallett. I have a comment about that, and certainly this is looking back from over the decades of being, which I think sometimes is helpful being a much older person, is originally when things were made where you had to go to the school that you live closest to, you know, when the Supreme Court said that, it was to make people mix in black and white, and that is indeed what happened with us. But the people who lived next to us who were white were poorer than us. Our parents were college educated and worked well. And in part, we lived where we did because that's the only place we could live. And so some of the kids who were Caucasian, I could see how they experienced almost a reverse of some of what people assumed we experienced because of where we lived. And so I can see how this may be a very valid experience of them feeling marginalized because of what was going on at that time. And so I would ask this person to tell me more about what helps her to feel this way. It may not be just automatically defensive. It may be a reality for her.
Yeah, and I think it's important to validate that person, but then you also want to turn it back to the topic at hand, because I think what happens is that sometimes white fragility and the white feelings get in the way of us addressing the larger issue of the systemic racism. But I do think that's exactly right, Dr. Mallett. Like, you want to validate and figure out more, but then you also have to say, but right now we're discussing this particular issue in racism. So can we, you know, we may follow back to that. Like if it's a PBL and you meet with them often, you may want to follow back to that. Yeah, but
she and her feelings may be in a nice way for if she could be explained to other non-Black people, her own experience, both in terms of what it was like growing up in school, but what it's like for her when she goes out in public and people don't know anything about her economic situation.
Great. Do we want to move on to the next slide? Okay. Oh, I guess the other part of the question is the feelings in the facilitators that arise when comments like that are made. Sorry, Kristen, if you want to go back. Yeah, or other participants as well.
Gareth, why don't you comment on what you wrote in the chat?
Oh, sure. Yeah. Going back to what you've talked about earlier is this idea of multiple identities, and that we have intersectional identities that can make us, we can be simultaneously privileged and also simultaneously marginalized, and one does not negate the other. These are both true at the same time, and navigating what that means is complex. And so I think that this can also, speaking to the second question, I can see some people maybe in the audience who might hold a similar identity to the person who's speaking up could feel the same way in some ways, or their lived experience might be very different. And there's so many of these identities that are invisible that it's very difficult for us to know where someone's necessarily coming from when they express these emotions. So I think as a facilitator, it's being able to take that moment to take the breath, to try to like, you know, see what's happening there before you react in some kind of specific emotional way, but to let the statements be there in the room and let people kind of process that before you take any kind of like judgment condition, right? I think the key there, as you said, is validation, right? It's your lived experience is your lived experience. That's your truth, and that's what it is.
Yes, that great points. And I guess we can move on to the next slide. Oop. Yep, there we go. Conversations about race can often evoke a lot of feelings, like the one seen on the screen and the ones that we were all just discussing in the opening example. And like we were talking about, that can be really uncomfortable to deal with, both as a participant and a facilitator. And particularly if you have the responsibility to kind of keep the conversation going and the discussion happening, it can be intimidating to try to facilitate discussion when there are just so many strong and sometimes opposing feelings. And we hope that this workshop really helps provide some of the tools to continue those important discussions so that we feel more confident in facilitating them. Yes, next slide. One thing to be mindful of for these discussions is re-traumatization, and the fact that these conversations can stir up past experiences of trauma for both the facilitators and the participants. Re-traumatization can lead to feelings such as being on edge and difficulty sleeping, intense feelings of guilt, anger, anxiety, sadness, low energy, and avoidance. We obviously aim to not re-traumatize during these conversations. However, it's important to recognize that it's a risk and alert participants to that risk, and to take measures to minimize the risk, both through facilitation techniques that we will discuss and then also self-care, making sure you're getting adequate sleep and nutrition and taking time to reflect on feelings both internally and also reflecting with others can help. I know we do kind of debriefing among facilitators after these activities, and encourage, you know, the students to utilize kind of their own kind of mental health supports. And then we also actually alert and provide resources, mental health resources to participants in kind of their participation packets and things as well, so that people kind of know where to go if this stuff gets stirred up or these feelings get stirred up. Okay, next slide. So returning back to our example of the female student stating that she's equally marginalized because she grew up poor and female, even though she's white. The facilitator then responds, okay, then let's talk about the experiences of women as an oppressed group. In fact, there have been many studies about gender-based microaggressions towards women of color, for example, through sexual objectification. What do you all think of this facilitator's response? And there's a small enough group. I mean, please feel free to just unmute and talk.
This is Rob. I'm sorry.
No, go ahead.
I was going to say I like the comment, but I knowing me, I would have said, honestly, microaggressions towards women and particularly women of color. So that I felt like I acknowledged her, but also went back to what the purpose of the conversation was meant to be.
Absolutely, because I guess the risk is that you get kind of sidetracked into a different discussion. So certainly that was a great point. Anybody else?
I guess maybe it's similar, but I as I read it and I was trying to process it and think about what I felt just immediately seeing what she said, and if I were in this group. And on the one hand, I can appreciate her attempt to transition the conversation back to be on point about the racism. On the other hand, and without making the person who was bringing up being a female and still feeling marginalized because she was poor, but still, it almost, if you're there and you're dealing with racism, And as an African-American female, I could see how I would still possibly be offended that you're still saying we're talking about women. Like, okay, well, let's change the subject. And you could, I don't know, I don't know if I'm explaining myself well, but I don't know, I can appreciate her point, but yet still a little tricky there.
Mm-hmm.
I think I would agree with that in the sense that it would have been nice to answer. I think she was, the woman in the example was really focused on racism, which was the main topic. So she was sort of on topic. And then to switch it to gender-based microaggressions, it seems like a deflection more for avoidance than for answering her particular issue.
So I would like to say that I think it's an opportunity, and similar to what was in the chat previously, it's a real opportunity to acknowledge what the topic is today, but yet validate this person. And if, as was suggested, it could be segued back to the anti-racism discussion that they wish to have, I think that's really important.
Great. Yeah. So I'm hearing a lot of themes in terms of validating the comment in that, you know, that is her lived experience, but making sure to bring the conversation back to the topic at hand and not let it get sidetracked into a different conversation. Okay, I guess let's move on to the, great. So in thinking about some common mistakes with facilitation, the first mistake is doing nothing. So these conversations are really hard, and it may be tempting to let a comment go. However, it's important to not let the comment go and to really have these conversations. And we'll talk more about that throughout the rest of the time. Getting sidetracked, like I already talked about. You know, fear of these conversations can lead us to, or defensiveness can lead us to avoid the conversations or easily move on to another topic. Appeasing the participants by allowing the conversation to become sidetracked, stressing commonalities and avoiding discussing differences, not exploring personal feelings, as you guys have all kind of pointed out, and avoiding confrontation. These conversations are inherently uncomfortable, but we need to embrace that discomfort and sit in it. 4, another common mistake is ending the conversation, because these are important conversations, and this can take the form sometimes of, okay, we'll return to this issue and then not getting around to it, or the class ends. But again, we want to have these conversations. And then the last one is self-explanatory, but maybe take the form of becoming angry or shutting down the conversation, kind of snapping, etc. Okay, next slide. So returning to the same example, we can move on to the next slide because there'll be kind of multiple choice and some different possible responses. Here we go. You just, yeah, click to the next slide. There we go. Here's some 4 possible responses to this. What do you guys think about these different responses?
I like B, because I think it validates her and it opens up the point of, you know, to talk about people of color. My worry, though, and maybe this is just a psychiatrist part of me, that it still doesn't, I mean, there's a part of me that teaches, but who knows what else she could bring to the conversation. And so I'm not a good typist, and I posted before, we would always have a list when I did PBL of things we must get through, but that if we wanted to learn more and talk about more, we would save time, and we'd have a list on the side of the board and we could talk about more. So just because we're talking about, we must get through the topic of what it's, microaggressions and what it's like we're talking about race at this point in time, doesn't mean we can't learn and discuss other things. Let's get to what the course directors say we must get through, and we can always learn more as a group.
Mm-hmm. Well, that kind of brings in, I guess, point D, and I kind of, too, I guess Robin felt torn between B and D, or maybe some combination of the two.
Yeah, no, we made the answers, so that there would be things to discuss. So yes.
I personally like B, because also one of the things that we need in terms of addressing racism is to establish empathy and understanding. We cannot accept as one form of aggression or oppression is more justified than any other. So if we have people understanding that they are affirmed in their feeling of oppression, but then bringing them to see, now let's work together with this specific one, that's the focus of our conversation. And how can you join us in making sure that those things don't happen, and bring your experience to be an ally to the women of color or the race issues in this conversation.
Mm-hmm. Yes.
Part of it too possibly depends upon how, and it maybe goes back to what Dr. Mallet was talking about earlier, how it comes across from the individual. There are some people that are being kind of catty, and they really will change a conversation because of their own biases. And then there are other times that the individual feels sincere, as Dr. Mallet was kind of pointing out, in truly feeling marginalized in a different way, even though it's on a different topic. And that may then kind of change how you would even respond with those.
Absolutely. The context and the kind of intention and feelings really matter behind the statements. So I guess let's move on. Oh, go ahead. Sorry.
I'd be interested in why you chose this conversation to occur in a large group. Just is there a teaching point for us that you have in mind?
Oh, so we actually didn't really know when we created this whether we would be able to break out into small groups. And so
no, I don't mean that. I mean, in the case itself.
Got it. Okay.
I'm going to have my racism and anti-racism discussion in a lecture hall with 200 people.
Mm-hmm.
Oh, I thought it was a small PBL group.
It said large group lecture setting.
Oh.
So is that something?
I don't know why I just assumed PBL.
Yeah, that some of you have tried, and is that a strategy worth pursuing?
I don't think it would change my response.
Okay, please. No, yes, tell us how it changes it. Because that's an excellent point that I actually didn't catch, because that does make a difference.
No, I'm saying for me, it would not change my response. The only thing would be that if it were a larger group, to me, you have to get through it faster because you cannot be derailed because you don't know what all that's why my comment was about my PBL group. If you're in a lecture of 200, you can't get too derailed because you got really some stuff you got to get through. Whereas in my small group PBLs, I kind of know each one of them a little bit better. And so I can say, okay, let's do this and we'll come back. But in a lecture hall, I would make the same comments, but I wouldn't dwell on it. I'd move on.
We at Southwestern have had kind of large, to the entire class of kind of anti-racism discussions about, they had watched a video and we did a discussion and it went well. I don't know if any of my other co-presenters have other experiences or thoughts on the question of the large group setting.
At UTMB, we've done it large group to kind of set the stage for kind of background and what this is and to provide some of the context, and then small groups for some of this level of discussion and actually going through cases and almost in a problem-based learning kind of environment.
Yeah, my concern would be in a large group. First, you need to create psychological safety to have any of these conversations. And that just gets trickier the larger and larger the group is, whereas as Dr. Patel said, it's giving them that chance in a smaller place that could be made safe.
And what is happening in this context of this year is that this is typically something that would show up in the chat as a comment. And then that would be, then how can the speaker or the facilitator address that?
Mm-hmm. I mean, what are people's, that's actually one of the case examples, but I think that's an excellent point that we should just talk about now. So what are people's ideas on that? If a comment shows up in the chat of a large group discussion?
It actually has happened in UTMB. And then there were two conversations, the presentation going on, some answers being given, and then a whole sidebar conversation in chat addressing that specific issue, different people talking to that person.
So can I ask, how does the teacher manage that? Does the teacher acknowledge that second conversation, or do they just say, this is a physiology course and I'm not really prepared to manage that?
So when we had it happen at UTMB in one of our lectures, and so what we did was, we had other students who were actually educating those folks in the chat, and that was helpful. But what we had to do was actually end up turning off the chat during certain parts of the lecture so that we could continue with what we were supposed to be discussing that day. And then we had to turn it back on when there was more time for discussion, because and so there was, there's multiple approaches you can take. Sometimes the other students will do a great job of educating or sending like articles to the other students. But at some point, when it becomes too derailing or also too offensive, right? And so in a large group setting, you're not sure how many people are being offended at the same time, then it was best for, when I was during the lecture, it was best for me to just shut down the chat at the time.
Mm-hmm. But it sounds like you guys went back to the issue, and there were other places too within the curriculum that some of these issues were addressed. Because I guess I was wondering about the debriefing and stuff after something like that happens, or
yes. Dr. Patel, do you want to talk about the debriefing that we do?
So I did want to mention, because I think this has happened multiple times, so I'm glad it wasn't just me, but definitely at one of our sessions, we did have the chat blow up, and a student on 2 occasions jump through hoops to figure out how to anonymously put comments in the chat, which I didn't even know was possible, but somehow it is possible. And the first time it happened, as course directors, we didn't really know how they were doing it. So we were trying to actually text IT to try to figure out, well, can we turn something off so this person can stop doing it? And the second time it happened, I think I told them to cease and desist, and that they needed to stop anonymously chatting. But we did have a debrief with one of the psychiatry, I want to say child fellowship, child fellows, with our students, especially our students of color, after some of these sessions. And I think that made a huge difference, because we didn't have that the first year. Second year we had that, and those students were able to kind of have someone who understood that this can be re-traumatizing, and also because they are in an environment with their classmates, they're also seeing the variability in their classmates' attitudes and life experience. And sometimes, you know, it's not where they feel like it should be. So, you know, there's kind of extreme kind of a disappointment associated with that as well. So it was actually, I think, having those debrief sessions with the students afterwards, immediately afterwards, and also the next day was incredibly helpful for those students.
Great. Thank you for sharing you all's experience with that. Okay, I guess let's move on. So let's move on to talk about strategies for success. First of all, and others have brought this up, we really must take the path of being a forever learner and identifying as a non-expert without using this as an excuse for ignorance, and taking responsibility for both your intention and impact. And that's something that we emphasize at Southwestern when we're doing these activities. Okay, and I think if you'll click, Kristen, because I think it'll pop up. Perfect. So it's really important to recognize kind of the influence of these social norms that are influencing people's behaviors within these discussions. So the idea of the politeness norm, again, people don't like being uncomfortable, and these conversations are emotional. And so in order to avoid these feelings, society has deemed them as impolite. However, not having the conversations, as we've talked about, has just really lethal consequences for our patients and our fellow human beings, our colleagues. The academic norm, so this idea that there are expectations in academic settings that intellectual conversation should be objective and detached and rational. However, those are adjectives, or just not, they don't fit race-related discussions. And then the colorblind norm. So like we've already discussed, the phrase "I'm colorblind" was implemented as a defense mechanism and a way to sort of avoid these conversations. But that phrase in itself is racist because it invalidates the experiential reality and the feelings of a person of color and leads to avoidance of the discussions about racism. So, next slide. It's also, again, important to understand the context of these discussions. There's lots of feelings, like we've already been talking about: defensiveness, anger, anxiety, fear of confronting one's own privilege, fear of appearing racist or being racist, fear of responsibility for taking steps to end oppression. There's also lots of power differentials in the room. And, between facilitators and participants, and white participants and participants of color, attendings, residents, medical students, and staff. And these are, finally, these are deeply rooted issues in society. When we actually talk about, do our anti-racism workshop within the psychiatry clerkship, they actually give a history lesson along with it to try to emphasize how deeply rooted this is in society, which, people may not have thought much about these issues, unfortunately. And so helping people to understand that context is important. Perfect. And then I know Pierre already brought this up, but the importance of understanding your own racial identity, particularly as a facilitator. We use the address model at UT Southwestern, which was developed by Pamela Hayes. It was meant to help therapists identify and appreciate the complexities of individual identity, but we like to use it for our participants in our workshop. The model recognizes cultural influences as intricate and multi-dimensional combinations of factors. And so address is an acronym, stands for age and generational influences, developmental disabilities, disability acquired later in life, religion and spirituality, ethnicity and race, socioeconomic status, sexual orientation, indigenous heritage, national origin and language, and gender. And it's really important that we do this, first of all, because we need to be able to remain calm and non-defensive and skillfully facilitate these discussions. And then also recognizing the areas in which you are a member of a dominant group can help you become more aware of the ways in which privilege may limit your knowledge and experience regarding minority members who differ from you. It also allows you to appropriately acknowledge and also self-disclose relevant personal challenges and fears and triggers, and help role model that for others. It is okay and encouraged for facilitators to offer their own concrete and personal examples. Okay, next slide. It's also really important to set expectations early on about these discussions, forewarning participants and planning ahead for it. You obviously want to adequately plan these activities with appropriate pre-readings and time for reflection and coordination. We send packets out, at least for the anti-racism workshop and the clerkship. We send a packet with the safe space guidelines and pre-workshop activities, so that people kind of come having thought about the address model and their own kind of personal biases and feelings ahead of time, and can also just prepare them to be in that a mental space to have these conversations. It's also important to establish ground rules. Again, we talk about the safe space guidelines and the perspective of trying on new ideas. Like Premal talked about, this idea of being present with and embracing discomfort, asking why you're uncomfortable, and helping participants to understand the difference between intent and impact. We also encourage a self-focus, so that participants are only speaking on behalf of themselves, not on behalf of or making assumptions about a group. And we encourage people to voice discomfort or doubts, confusion, and fear. And then we also talk about the move up and move back framework, so that if you've been quiet, we encourage you to move up and share more. If you're finding yourself speaking often, move back or consider moving back. And then we also set the expectation that there's going to be mistakes and misunderstandings and potential ruptures, and encourage people to recognize that and be open to repairing the ruptures. And we only do this if we acknowledge when we feel hurt, and then provide feedback thoughtfully without blame or shame. And then we also discuss the importance of confidentiality in these discussions. Okay, next slide. Yep. And then in facilitating these tough conversations, as others have talked about, it's really important to control the process and not the content, unless it's, as we've talked about, it's just very inappropriate and hurtful, in which case it's important to step in. And that can take the form of helping participants to name the emotion, as others have talked about. Sometimes you can role model that by saying, I'm noticing that I'm feeling a little, X, Y, or Z emotion when I heard that comment, or I'm noticing that people are not responding to that comment. I'm wondering what people might be feeling right now. Again, if people speak when it feels unsafe to do so, it's important to express admiration and appreciation for that, and being really intentional about that. And then ask questions. We want to take the position of being a lifelong learner. Okay, next slide. So responding to difficult dialogue. Like we've already talked about, acknowledging the accuracy of the statement if appropriate. So yes, you are right that women are facing discrimination. However, it's important to bring the conversation back to the issue at hand. But today we were talking about race. You want to intervene in the process and not the content. We don't want to silence dialogue, and we want the participants to have these difficult conversations. And so using process observations can ultimately help unmask the beliefs and the attitudes of the participants. So what do you all see is happening here? Asking questions about how participants are feeling is another tool. And as I talked about in the setting expectations slide, it's important to help participants see the difference between intention and impact. So if somebody states women are oppressed too, asking the participants to explore their intention and possible impacts of those statements, and encouraging people to express when they are feeling hurt or feel like there's been a microaggression, and then praising them when they do. And then 4, and we've already talked about this, but moving to the feeling level of the conversation. So saying things like, I'm wondering if you can tell me how you were feeling, or I find myself feeling this way when I hear that statement. Okay, next slide. And then I'll hand it off to Premal.
All right, so we have not a ton of time, but we do have another activity we'd like to have folks in breakout rooms for. I believe that maybe we'll just do 2 breakout rooms so that we have kind of a critical mass in each room, and we can go through at least 1 or 2 of some of these case examples. We'll share the examples in each of the breakout rooms, and you can actually as a group pick whichever one seems to resonate with you. And then when we come back to the large group, you can share whichever one you felt you were able to get kind of the richest discussion around. Okay, so we're going to go ahead and start the breakout rooms.
Just let me know if you need help with joining a breakout room. Does anyone?
Okay, I think we're back. So I know everyone's ready to get home, but so we just have 4 minutes. I don't want to keep anyone over. We certainly in our group had some discussion on the case. I don't know what case the other group discussed, but when you hear things outside the door that's not directly related, and how to certainly not ignore those things and go out and be involved with that and make an intervention, which is harder when they're not directly in control of the classroom. I don't know if the other group had someone wants to mention what they discussed there.
Well, I'm going to share a little story because, from one of our faculty, Dr. Moore, on the main campus, who does a lot of our anti-racism work. Anyway, he uses Monopoly as a way to explain it to white students who maybe never have experienced the lack of privilege. And he talks first about his love of playing Monopoly, and then he describes that when they pick their pieces, that he was told, oh, that green piece doesn't get to buy any property no matter what you land on. And then until 10 rounds have passed, or 12 rounds. And then, okay, now it's your turn. Finally, you can buy property, but there's no property left. And so he just taking you totally outside your everyday world. It's a beautiful metaphor for helping us understand.
Yes, I've heard that before too. Yes, helping students understand. Well, Kristen put in the comments that, again, fantastic discussions, and I agree, appreciate comments, conversations. Any other questions? I know it's been late in the day and everyone's been so involved, and I think, again, a very important topic. We at all our institutions are glad that we're able to bring this to the students and have everyone involved. It's just been, I know, great at our institution to do that. Kristen, someone's asking if they can get the PowerPoint as well, so I guess we will look into that. But I hope everyone continues their programs at their institutions, and hope the discussion has brought some thoughts and pitfalls that we've shared, and just to will help you in your programs as well. Any other questions or anything else? I think the chat's going, but Kristen, I think you put in there your email so we can get the PowerPoint to you.
And I think if you'll share it with Khalid, that he will add it to the materials that are already available, the on-demand materials.
Okay. All right.
Then everyone would have access.
I do have a question, but I'm not trying to keep anyone past 6. So if you want to leave, please don't let me deter you. I really enjoyed this topic, and I really appreciate y'all discussing it and people being willing and open to talk about these experiences with implementing these new practices. So thank y'all so much. I know y'all are mainly talking about teaching anti-racism in education, but one of the things that we've been trying to evaluate in our program is how do we recruit and retain diverse trainees and faculty? And we've had a hard time of knowing how to analyze this data and see if any of the changes that we're making are working. And I was wondering if anybody had any recommendations of things that worked for them to analyze that data to see if they're making an impact.
At least over at our institution, we've started doing like a climate survey. And so I think that's been a little helpful in trying to get metrics and a little understanding on what's going on in our department. Also, if people do leave, doing an exit survey also in a trusted environment. It'd be really important to see, like, why is this person leaving and what's going on? But make sure it's somebody that is trusted and they can be honest.
I think, Rachel, you addressed for doing surveys too with faculty, residents at UT Southwestern, and looking at those things as well. But
yeah, I'm like not a presenter, I'm just an attendee. But I actually worked on a project at Emory where we used ERAS data, because ERAS automatically tracks demographic data. And if you can get your program to track who they select for interview and who actually interviews, and then who is matched to the program. What we did was look at the data to look for potential intervention points. Obviously, resources are always scarce for this work. So if you notice that you're looking at the ANC data, if you're not getting the same representation in your applicant pool, then that's something maybe you can have a presence at national conferences, or something to beef up appeal to your applicants. If you're inviting them but they're not coming, maybe you're inviting them too late, or maybe you can have stipends or put them up in a hotel or something like that. So it really helped looking at that, and it also helped because that was at a GME-wide level, to go to certain more resistant specialty programs to point out that, I know that you say that you're interested in this work, but your data says otherwise. And also to foster a little healthy competition, we took the surgical subspecialties and kind of pitted them against each other, because ENT was doing really well and maybe some other places were not doing so well. And there's nothing, justice and equality are things that we all are motivated by, but also outperforming our peers is a strong motivator as well. So we use that to our advantage as well. So ERAS is a just available data to mine for anyone looking to do this work.
I love that. Thank you so much. Did you primarily look at race and ethnicity, or did you also look at sex, or was there any other characteristics y'all targeted?
Yeah, we looked at gender. Gender is a binary because ERAS is still tracking it as binary, and then race, ethnicity as well. And we had a particular, like, how we mapped out the different racial categories. But I'll put my email in the chat in case anyone is interested. I was supposed to write this up to submit, but then I had a baby and there was a pandemic. But I'm still doing that. That's still the plan. But yeah, so I just put my email in the chat if anyone's interested.
Great, thank you, Farah. Thanks for sharing. I appreciate it. Any other questions before we sign off? Thank you for sharing that. Okay, I guess we are 2 minutes over, so we did a great job. But I again appreciate everyone's input. I always learn so much, even though we're hosting. We learn from each other, and great to have so much interest in discussion. So I hope it continues onward. Thanks again.
Thanks so much.
Thanks so much.
Bye.